A friend of mine experienced one of the worst embarrassments of her life. She was in the market shopping and suddenly she had the urge to pee. She tried to hold it, but before she could reach the toilet, she started urinating on herself in the public. 4 months later, she still struggled emotionally with that memory. So when she reached out to me, I instantly knew that it sounded like urinary tract infection. And sadly, many women suffer in silence. So today's video, we will discuss more about urinary tract infection, causes, risk factors, and home remedy for urinary tract infection. So what is urinary tract infection? UTI in short occurs when infection, microorganism, bacteria sneak into the urinary tract, can be your bladder, the urethra, the kidney, and start to multiply. So this will result in burning, urgency, pain at the lower abdomen, and sometimes embarrassment. In fact, up to 60% of women will have at least one urinary tract infection in their lifetime. This condition is 5 times more common in women than in men. Why women? So there are some biological makeup that increases women's risks for urinary tract infection. And one of them is short urethra. Women have short urethra. Urethra is a tube that takes urine away from the body. So this makes it very easy for bacteria to find access to the urinary tract, then it migrates to the bladder and then to the urethra, the kidney. So bacteria does not go far before it reaches the bladder. The second risk factor or second biological makeup that increases our risk is the proximity of the anus to the urethra. So there's a bacteria called Escherichia coli, in short, E. coli. This lives naturally in the gut, but when it leaves the gut and travels to the urinary tract, it causes infection. Hormonal changes in pregnancy, menopause can also cause what? Increases one risk for urinary tract infection. During pregnancy, there's a hormone called progesterone that helps to relax the smooth muscles. And this will slow down urine flow, creating an environment where bacteria can grow. So any condition that causes stasis of urine in the urinary tract increases one risk for infection. Another thing that can cause urinary tract in women is the growing uterus during pregnancy. Presses on the bladder and other urinary tract, and this impairs proper emptying of urine. And remember, anything that affects urine emptying will increase one likelihood for having this condition. Yes, and that is why we will advise pregnant women to do what? To urinate frequently, Kegel, perineal exercise. Weak immunity. Yes, your immune system is lower slightly during pregnancy to protect your baby, but this can make you more vulnerable to infection because your immune system cannot fight this infection actively as it's supposed to. Other risk factors that you might be ignoring include holding your urine for a long time, wearing tight underwear, frequent sexual activity. Yes, diabetes mellitus, the glucose attracts bacteria. Harsh soap, when we dodge, we change the normal flora. Not peeing after sexual activity, dehydration. These are simple things that could increase your risk for infection. So what are those signs you should watch out for? So if you have any of these signs we will mention, don't ignore them. And they include burning while peeing, frequency, that's normal, frequent visiting the restroom, urgency, that urgent need to urinate, lower abdominal pain or back pain, blood in the urine. When you see these signs, see your physician. Untreated urinary tract infection can lead to serious kidney infection, even long-term kidney damage. So it is very important you do what you don't ignore. So to protect your kidney. Tests and treatment. Your doctor may request you do urinalysis or urine culture. The urine culture will identify the bacteria or the causative organism, and they will place you on antibiotic your body is sensitive to. Remember to take your antibiotics exactly as prescribed. Don't stop halfway to prevent your body resisting that antibiotics, and protect your kidney, because once this bacteria are cleared from your system, your kidney will be protected. How do we beat this UTI naturally and prevent them from damaging our kidney? Stay hydrated. Don't hold your pee for a long time, even when you travel and you cannot urinate. Once you reach your destination, take adequate fluid to flush any bacteria out of your system. Women wipe from front to back to prevent introduction of this bacteria into the urinary tract. Very important. Wear cotton underpants, underwear, pants. Avoid scented products or touching. Urinate before and after sexual activity. Drink water after sexual intercourse to flush out any bacteria. Avoid caffeine, alcohol, and spicy food. Rest. Manage your stress. Practice personal hygiene. Be careful where you urinate, where you use the restroom. If possible, go around with sanitizer. Disinfect the toilet before you use. Very important. You are just putting precautionary measures for yourself. So when we rest, we allow the body to do what? To heal. When we manage our stress, we boost our body immune system to do what? To fight infection. So what are those home remedies that could help? This will not replace treatment, but they can help your body to recover and to prevent reoccurrence. Drinking Zobo drink, also called Hibiscus Tea, causes natural diuretics, and this can help to flush the bacteria. Coconut water keep you hydrated. Fruits rich in vitamin C, pineapple, orange, watermelon can boost your immune system to fight infection. Warm compress can help to ease the discomfort you are feeling. Probiotics can help to balance the good bacteria in your gut and urinary tract. Remember, when you have this infection, shower instead of top bath. This will help to what? To flush out any infection. If you have been embarrassed or suffered in silence, like my friend, that you are not alone. You are not alone. Urinary tract infections, they are common, but they are beatable. I am Ozioma Okonkwo, a registered nurse, a midwife, and a public health nurse. I break down real health issues with clarity and compassion. So if you have been with me till this moment, please help this channel to grow. Subscribe to my channel. Watch this video to the end. Share with your friends. And also drop a comment. Real health talk. Let me know that this information is useful and drive home. So stay healthy, stay confident. Don't let urinary tract catch up with you or cut you off guard again. I encourage you to drop your questions, your experiences in the comment section, and I'll be there listening and reading your comments. If there is any other topic you want me to cover, I will be glad to do so. Just drop them in the comment section. Don't forget, your health matters. So be intentional about your health. Stay safe. See you in my next video. Thanks.